Hey guys, hope you're doing fine. We are live through IFMSA-Pakistan's YouTube channel, and I officially welcome you all to the IFMSA-Pakistan's digital side event. And we will proceed officially. And I would like to hand over this to Himalsana, co-coordinator. She will take on this altogether. Thank you.
Hi, Himail, you're on mute.
Himal, you're mute. We are not able to listen to you.
Okay.
Yeah,
Sorry
yeah,
for
yeah.
that.
We can hear you. Yeah,
All right.
you can go ahead.
Okay, so let me start. Thank you so much, everyone, for joining us today. It's a great pleasure to have you all. So, today we're going to be talking about a highly pertinent topic of health systems and planetary health, and how we are all going to face these problems and new strategies falling under universal health coverage for the post pandemic world. Joining us today is an amazing list of panelists, starting off with Carolina Rojas, joining us from IFMSA Chile. She is the regional assistant of SCOF Americas. Then we have Mohammad Osman from Medicine Sudan, who will be talking about universal health coverage, and he's currently the regional assistant of SCOF Africa. Then we have the amazing coordinator for health systems, Bashir Al Mashgari from Yemen. So it's great to have you all. Now I'm going to give the floor to Adil to introduce rest of the speakers.
On fourth, we will have the amazing place. We have IFMSA Sweden, Lotta Billen, and last but not least, we would have liaison officer for public health issues, Omina Al Amirani from IFMSA Egypt, and they all will be talking about the topics that concerns them under the umbrella of universal health coverage. So I think we should get started from our first panelist, Catalina. Floor is yours. Thank you so much.
Hello guys, should I share my screen directly?
Yes, you can do that.
Yes, sure, go ahead.
Okay. Give me a second. No. Oopsie, wrong one. Okay. So, do you hear me?
Yes, we can hear you.
Awesome. So, hello guys. Thank you so much for the invitation. It's my first time in talking to you, IFMSA-Pakistan, and that I've been invited by other regions. I'm really happy to be here with Mohammed. We prepared this presentation for you. I'm really happy to bring the experience from my region to you. So I hope you enjoy it. Feel free to interrupt at any minute. For example, if my internet cuts or if you're not understanding my English, I'm sorry. Sometimes with the different accents, we can get lost. Our topic today is UHC and strengthening of health systems. But since you gave me the amazing opportunity of opening your lovely panel, my part will be a little bit more of an introduction to the concept of UHC and everything we will be talking about. And Mohammed will give you a little bit more of insights of the strengthening, and then he will be able to introduce himself to all of you. So thank you so much. As you know, I am from IFMSA Chile. I'm Chilean. And I'm also really into everything that happens in Latin America, so I will be giving you a lot of insights into that too in the little time that I have. So let's get started. The concept of UHC seems really fuzzy for many of us if we don't actually know it deeply or if we haven't worked in it. What are we saying exactly when we're talking about UHC? Universal health coverage is actually a concept that comes a long way before, but is like into our mouths since it is in the SDGs, the Sustainable Development Goals, the 2030 Agenda. Okay, these goals for the development of the world that the United Nations set for the 2030. In the Sustainable Development Goal number 3, that it's health and well-being, there is like a little objective like inside it that is the 3.8 that is exactly and specifically for UHC. So you must be thinking then it is a really important topic if it is addressed directly in the SDGs and it's such a global matter. However, it is still really difficult to bring up concretely and to discuss about it and to think about the things that we can do, maybe as medical students or as common people about it. It seems to be something that politics, like people, like stakeholders, people from the government talk just between them and they take the decisions and we have nothing to do about that. So I really want you to take home the message that UHC is something we all build. I always, when I talk about UHC, I put into this quote from Dr. Tedros, the Director General from WHO, from 2017, that says that no one should get sick and die just because they are poor or because they cannot access the health and services they need. For me, this quote brings to life everything that UHC should be. More than every fancy definition that I can bring you today, this is UHC. UHC, for me, it's bringing to our population, to our people, to everyone, the minimum they deserve. And why do I say the minimum? UHC is defined as our communities, our people accessing the health services they need when they need it and not having to pass financial hardships due to that. Okay, now having all the population covered under this umbrella, the umbrella that's the face of UHC, this icon, might seem something really ideal. This dream we might not be able to achieve because it seems so pretty. But what I want to tell you today is it's the minimum, people. It's what we should be striving for every day because it's what every person in the world deserves. No one should be dying today because they are not able to pay what they should be getting. And at the same time, in one country, there should be not a difference just because someone is able to pay one health care than other. Okay, sadly, it's something that happens almost all the time, at least in my reality. Okay, and I hope it doesn't happen in your reality, but I'm really sad to think that it might. Okay, so the general broad objectives of UHC are achieving equity, equality, and financial protection of people covered under this, okay? Equity in the access, quality of this access, and financial protection of the people who access to this healthcare. How does this work in real life? The truth is, these are the raw objectives. And I think it's really important for me to mention this, even though these are the basics of the basics in UHC, because if we are doing a panel towards this topic, it's really important for us to reflect over the basics and understand why this might be failing and why we are not achieving this as easily as it should be being achieving, the thing is, achieving equity and quality and financial protection at the same time, it's really difficult for some countries. They tend sometimes to prioritize one of these objectives over the other. Giving you the example of Latin America, what happens in my reality is that some people in this country, there is a supposedly universal health coverage in most of the Latin American countries. For example, most of our countries actually guarantee the access to health in their fundamental letters. However, there is no financial protection over the people who access these treatments. For example, for COVID, there is people who is having now financial hardship due to their access to COVID treatments. Okay. And I mean, like, real financial hardships, like debts that they are going to have their entire lives. So, does that work for real? Is that UHC? Are we having actually UHC if people have to get into these enormous debts for the rest of their lives when getting into a treatment, whatever treatment they have, especially in these times of pandemics? Are they going to feel safe going to hospital or whatever if they know the system is going to trick them that way? Okay. And I could give you many other examples. In other parts of Latin America, we have countries that assure access to primary healthcare. However, the quality is really poor, or there is no investment in technology, so people is not able to access the correct treatment they have. But there is universal health coverage, so it's tricky. And governments say, okay, we have universal health coverage, but it's not real. It's not ever going to be real if we don't have these three elements. But the truth is, it doesn't happen all at the same time, and it won't ever happen at the same time. And what I want you to take out of all of this, more than all of these maybe frustration that we all have sometimes to our governments, to our health systems, that why are we not giving enough, is that it's possible to give enough, and we can contribute to that giving enough. We are going to the part of strengthening, but I want to talk about the three dimensions of where of how UHC expands. How does it work? Why it doesn't happen all at the same time, and it can't happen at the same time, sadly. And how does this gives you, all of us actually, the foundations to work towards expanding this coverage? Okay, so let's imagine this cube is the coverage. Actually, this is like the money, the sources, the funds, but let's think this is the coverage. Okay, it's more clear that way. The painted cube, it's all of the parts that are covered of our system. Each cube of each country is different. Some of them are bigger, some of them are more little, some of them are not actually cubes. But the thing is that they should be shaped the way that the country needs. Okay, some countries are needed or need the most to cover more population, like more urgently right now. For example, I give you my closest example, my country. If you ever see in the maps, Chile, it's a really long country. So we have north to south. We have to go on plane to some parts of the country because we cannot go on a car. So actually covering all the population is really hard due to topographic stuff. So covering all of them, it's one of the priorities, okay? Covering all of this niche is a priority for the government. So our cube, for example, is kind of more extended to who is covered, to that dimension of the coverage. On the other side, which services are covered? That's another dimension. Maybe not all of the services are covered in your health system particularly. Maybe you can't access all of them easily, or they are not disposable, or they are not like available in your area. All of that goes into services. Which services are covered for me, or which services are available at that time for me? And the one like right up is direct cost. Which part of the costs that I have to pay are like paid for me? But this doesn't mean that we have to give free healthcare, which is another pathway. This is reducing the payoff, like the pay out of pocket and everything that people has to to pay for themselves. It's kind of difficult to understand. Free doesn't mean better. Okay. So it's really important for us to understand these three dimensions. How do they expand, and why it is important for us to understand how we can contribute in each. There is one dimension lacking, the quality part. So let's imagine it like the quality of the material of the cube. If it isn't solid, then all of the healthcare that we give won't be useful. So I'm giving the floor now to Mohammed. Mohammed?
Yes, I'm here. Thank you very much, Catalina, for the amazing introduction.
Yeah.
Yes. Yeah. Can you hear me, guys? I guess am I audible?
Yes.
Oh, yeah, that's perfect. So thank you very much for the amazing introduction, Catalina, and thank you very much for IFMSA-Pakistan for organizing such an amazing initiative. My name is Mohammed. I'm a fourth-year medical student from Sudan, and I'm the current SCOF Regional Assistant for Africa. It's my second time in IFMSA-Pakistan, and I'm really excited to deliver such a short presentation about universal health coverage and health system strengthening. Let me share my screen now. Okay, so health systems for UHC. I'm 100% sure that most of you have heard about the health systems or have read about health systems after this COVID-19 pandemic. And this is really sad because health systems is really an important topic, but at the same time, it's very neglected and not a lot of people are interested in health systems. Not a lot of countries actually are also interested in health systems, although the health systems are really important for countries and governments more than individuals and more than citizens, because for the countries and for the governments in general, they do care about the financial prosperity of their own countries. And in order to have a prosper financial aspect, you have to have healthy lives. Health system strengthening and universal health coverage can ensure that. UHC 2030 consider the strengthening of health systems for universal health coverage as a vision for healthy lives. They consider that as a safeguarding mechanism for the communities in order for them to prosper and in order for them to live a very productive life, and eventually in order to secure their own lives and in order to have a better quality life. In this presentation, I'm going to tell you a bit about how the strengthening of health system should look like and what are the main pillars and what are the main dimensions. It's really a very big topic, and it's not something that can be presented in one webinar or in one presentation. For the strengthening of health systems, as some of you might know, we have 6 building blocks of the health systems. But when it comes to the strengthening of health systems for universal health coverage, the Universal Health Coverage 2030, the department of the WHO recommends that we should work on these 3 pillars or these 3 building blocks: the health financing, the governance, and the service delivery. I know that for many of you, the concept of health systems are not that clear. But let me tell you that health systems are all the institutions, all the organizations, and the individuals that are or that aims to increase the health status or the health situation in a country. So we as IFMSA, you as animals are also part of the health systems in your nations. Starting with that, I'm also sure that when we ever speak about the health systems in our own nations, we remember a lot of mistakes, we remember a lot of frustrations, we remember a lot of setbacks. An example, in my country, I know that we have a lot of health centers and I know we have a lot of health facilities, but at the same time, I know that no one is taking care of that and no doctors are being assigned to healthcare centers. And this is really sad. We do have the facilities and we do have the centers, but we don't have the enough leadership. We don't have the enough governance. That's why we believe that our governance is really important, and the governments and the Ministry of Health are really responsible of such a thing. The governments and the ministries are responsible of ensuring that people are being assigned to different centers. People are being empowered, people are being motivated. We have a lot of areas being covered. And in the African countries, in example, this is one of the main issues that we have. We might have the resources at some points, we might have financial aid from external governments or from other governments, but we don't know how to govern that, and we don't have the enough leadership. And that's why governance should be improved, and governance is a very important area to be worked on and to be improved. Moving on from the governance, the service delivery. For many countries, the service delivery is one of the most critical parts. Speaking about many countries around the world, they do have some services, but it's not well distributed. There is no accessibility. The center of the country has a great accessibility to the different healthcare services, but at the same time, the rural areas and the villages do not have that access, and they are not able to access the medicines, they are not able to access the different services, they are not able to meet professional doctors, and this is really sad. And even if they are able to do that, even if there is accessibility, not all the services are being delivered. Health services are not only about treatment. Service delivery should also include the promotion, should also include the palliative care, and should include a full package of services. Universal health coverage is not merely about delivering a health service. It's about delivering a quality health service that secures people from having financial hardships. If we offer treatment, but we don't offer palliative care, if we offer treatment, but we don't offer health promotion, that is definitely not a high quality service delivery, or this is not a high quality health services, and we need to put that in our consideration, and the governments need to increase their policy work on that, and even us as medical students can contribute to that, because we are the future of our nations and we are the future of our countries, and this is definitely possible. The last policy area is the health financing. And this is really tricky and this is really funny because whenever we speak with our governments about universal health coverage and whenever we speak about something related to health, they usually get excited. But whenever we start talking about resource allocation, pooling, resource prioritization, or any thing related to health financing and related to money and cash, they stop getting excited and their voice tone get changed, and this is really sad. An example, in many African countries, there is less than 15% of the overall budget of the government being allocated to health. An example, in some countries, without mentioning names, they have only 3% or 5% from their overall budget being allocated to health, which is really sad. They even allocate more money for the army and for the police for the police and the security of the country. They allocate more money to the security than health, and even they don't have wars and they don't have to worry that much. But yeah, this is how our governments think, and unfortunately, UIT is a very political thing and it depends on the political will of the government. So these are the three policy areas that we can work on in order to strengthen our health systems, and that we need to consider when writing a policy or we're creating something on strengthening our health system strengthening. Moving on, the health system strengthening should focus on 5 dimensions of health systems performances. We need to acknowledge that health system strengthening is not something standardized and we don't have a specific template for that. It has specific dimensions and specific pillars and specific principles that we need to consider. But at the same time, we can't say that this template or this approach fit all the countries. Okay, that's why we need to consider these 5 dimensions, and then we need to tailor our health systems according to our government, according to our country needs, according to our citizens' needs. Starting with equity. Giving access to the rich people is not universal health coverage and is not the right thing. We need to have equity in our health systems, in accessing health. The marginalized communities, the refugees, people who are not able to access health should be considered. And we need to cover all the country, all the continent, and every single city, even the villages. Responsiveness. The health system should be responsive to people's expectations, should meet their expectations, and should live up to their aspirations. At the same time, whenever we design a health system, we should also consider the traditions, we should consider the culture in this country, because otherwise it will not fit this country. The quality. When we ever mention the word quality, we should think about the achievement of the desired outcomes. Our health systems should be able to offer us the desired outcomes, should be able to heal people, should be able to treat people in the best way possible, and at the same time they should be efficient. What I mean by efficient is that we have certain amount of resources being allocated to our health system, and that needs to be used properly, that needs to be used efficiently, because otherwise if we do waste our resources, we will not be able to cover all people. We have to make sure that the certain amount of resources that we have is being paid to the right people and in the right way. The last dimension that needs to be considered, and I'm sure that you heard that a lot, the resilience of health systems in case of emergencies like COVID-19. Many of our health systems proved that they are very fragile and they can't even stand any sort of emergency. The COVID-19 pandemic is an eye-opener that each and every country should pay attention to. Our health systems need to be resilient and they need to accommodate all the different situations and all the different circumstances, because at the end of the day, we don't know what can happen and we don't know about the situation and the different aspects. Moving on, again, as I said, no one size fit all approaches. But at the same time, there are certain principles that needs to be considered and to be built on the dimensions that we already mentioned. First of all, leaving no one behind. We need to make sure that all of the community, all of the members, all of the sections, and every single person is being included and is being considered when designing a health system that is based on universal health coverage, and that is built to achieve universal health coverage. The transparency and accountability of our results is really important. At the end of the day, our leaders and our governments are not gods, and they're not angels. They might do mistakes, and they do mistakes actually, but they have to be transparent and accountable whenever they try something and it fails. The third point is evidence-based national health strategies and leadership. We shouldn't base our strategies and our health systems and our communities and our decisions on nothing or on assumptions. It has to be based on evidence. We have to do regular surveillance. We have to make sure that we understand our community and we understand our government, because otherwise we'll not be able to identify the good solutions and we will not be able to reach the point that we want. And the next point is making health systems everybody's business. Yes, I mentioned a lot the thing about governments being committed to health systems and being committed to health, but at the same time, we need to acknowledge that each and every sector in the community has some sort of contribution to the health. The approach of health in all policies is really important, and it should be considered when designing a health system or when strengthening a health system that aims to achieve universal health coverage. And yes, health is everyone's business, and health systems is everyone's business. The last point is the international cooperation. Many countries have inspiring stories with regards to universal health coverage and health system strengthening. We can make use of their experiences, we can make use of their personnel, and they can definitely help us achieve the point we want. They can definitely help us achieve the health system that we aspire to. These are the principles that needs to be considered whenever we want to strengthen our health system, whenever we want to achieve the universal health coverage. It's not easy, and it will never be easy. But yes, if we all aim to have the same thing, we will definitely have that. The last thing that I would like to say is let's work together towards good health and well-being for all, because this is the only one, or this is the only way that everyone will live a decent and healthy and productive life. I guess that's it from my side. And now I'll give the floor to the next panelist. Thank you very much.
Thank you so much, Usman, for your beautiful insight. Usman shared the experiences of African region about the universal health coverage, and he talked about the different situations, what is pertaining there. And Catalina talked about the models of universal health coverage, and she related it to her country, Africa, actually. And now it's time to know more about the global health finances. And for that, we have on board IFMSA program coordinator for health systems, Bashir. He is joining us from Yemen. Bashir, the floor is yours. Thank you so much.
Okay, thank you, Adil, and thank you, Muhammad and Catalina, for your good presentation.
Do you want me to share the screen?
Yes, please.
Okay, sure.
That will be okay. So as you know, like Muhammad and Catalina talk about the UHC, and they have give the proper definition of the UHC, and they give the proper definition of UHC and its elements. And now, like, we will talk specifically for the aspect of global health. financing and its relation with UHC and how we can achieve UHC if you work properly on the health financing in our health systems. Okay. So I'm gonna start first of all with a story with you. Once upon a time when I was working in a small clinic, a patient came to me. She was suffering from diarrhea for 3 days, and that patient has like a severe case, she has like severe dehydration, and when I ran the investigations, the routine investigations of that case. I was looking forward for the result of the potassium, like whether if she has hypokalemia or not. So my expectation was right. The patient has hypokalemia and like she was semi-conscious, like her Glasgow Coma scale was about 13 or 12. And in that case, this patient require an admission in the intensive care unit in order to avoid the complication of the hypokalemia and the its affection on the heart and the cardiovascular system. So I've told her husband in order to refer the patient to a more sophisticated hospital in order to admit the patient to the ICU unit, because the clinic that I'm working in do not have the ICU unit. So her husband replied that he will not be able to go to the central hospital of our city because he do not have enough money to do that. I insisted and I told him that it's a matter of life and death, and you have only a couple of hours. If you didn't go, you might have a serious complication, and no one know what will happen next. And he said, I will try. So he dismissed with patient, and after 2 days, I received news from one of the workers in our clinic that the patient passed away because they did not go to the IC unit in the central hospital. And the reason why, because they have financial hardship. So financial hardship is really a serious problem. And in that case, you cannot blame anyone. And that it depends on the country itself, whether you blame the person himself or you blame the health system itself. So the problem is really, really complicated, and the result of all of that, all of this financial hardship, is we lost the patient lost her life. So this is really bad, and it happens a lot, especially in the low-income countries. Okay, can you move the slide, please? Okay, the other one. Okay. No, the one with the circles, the previous one. Okay. So in order to justify the fact why in the low middle countries, like the people have or being in financial hardship more than the high income country, it's because they have a lot of out-of-pocket payments. So if you can see, this is a graphs from Global Spending on Health Award in Transition Manual from WHO. And this statistics from 2000 to 2017, it's a collective of statistics, and it reveals that most of the spending of the health spending in the low-income countries is come from out-of-pocket payments, which increase the burden on the people in low-income countries to pay on their health services, uh, in every aspect. They even some countries do not have even insurance or any um, financial services that support the citizens of that country. But on the other hand, if you see the high income countries, most of the spending is on the government, either through insurance programs or either through grants or something like that. So this is one of the main reasons that people get into financial hardship, which is one of the main problems that UHC want to solve, or working to solve. Next slide.
I'm sorry, am I lost the voice, or Bashir, you there with us?
Yeah, but the slide is not. It's not there. Yeah. Can you move to the other slide?
Yeah, sure.
Yeah, thank you. So here we will talk about why health financing. What is the benefit from the health financing? If we will focus on that aspect specifically. If you have a good health financing in our health system, you will ensure a lot of things, but most importantly, you will ensure that people will be protected from financial risks. You will make effective use of funds, and also you will improve the quality and equity and efficiency of healthcare. And regarding the standard definition of health financing refers to how resources are raised, pooled, and allocated or spent to ensure that each person has access to health services of good quality without financial hardship. Um, so, as Catalina and Muhammad said before, for example, free health services do not mean that you have a good quality of health services, but you have to ensure everything in order to achieve UHC, or in order to have a good health system. Your health services should be affordable and in a good quality that protects the people from financial hardships. And the key word in this definition is the words of raising, to raise the revenues, and to pooling the monies and grouping them together in certain categories, and then to allocate or to purchase the certain health services that you want to provide in your specific country or specific health system. Next slide. Next, the other one. Okay. So as you see, we have here the health financing and the health service delivery scheme, and it has the 6 building blocks of health system that WHO suggests for each health system to have. like these six building blocks are the main building blocks in order to uh, have a good health system that working in a good manner in order to achieve the full coverage and the quality and the efficiency. So these six building blocks are the leadership and governance and health workforce, health information systems, medical products, vaccine and technologies, service delivery, and the health financing. So the green ones are the health systems framework, and as you see, they are working in a compatibility together, like each one affects the other. So as you see here, like the leadership and governance at the top, and it's one of the most important aspects here. Like with the good leadership and governance, we will have proper policies in order to have a good administrations regarding the finances and the good allocation and good investment of the revenues from that health system, and that at the end will give us a good service delivery, uh, working with the health information and medical products, and also well-trained health workforce. All of that will give us a good quality and good coverage of our health systems, of our service delivery. So after that, like we will have our values that will make us reach our destination, which is the UHC. Like we will have a good access, we'll have efficiency in our health system, the equity and the quality and the safety and the sustainability. And at the end, like our systems will have a good responses, like our health system will be resilient for any external threats, any like changes that happen to that health system, as for example, COVID-19 crisis. And also, we will lower the risk of our health system in order to deal, as I told you, with the different external threats, and also to improve the health in general of that certain community. Next slide. So that was like in general, like the health system framework in general, and the relation between each building blocks, and the effect of the health financing, and also the leadership and governance in order to have a good service delivery. But now we will talk more specifically towards the building block that relating to the health financing. Next slide. So as you see, like in this scheme, like first of all, we have from the left, like the three important pillars of the health financing of the health system building blocks, which are the revenue and the pooling and the purchasing. So whenever you want to talk about the health financing, like these three aspects will be the most important aspects, because they represent the steps that each health system will do, but in different applications. It depends on the policies, and it depends on the resources of that country, how they can allocate it, and how they can deal with it regarding the concept of financing. So as you see, the revenue and the pooling and the purchasing are should be governed and like governed by the government and the leadership of that country. So you should have here strict policies and like good resources allocation. And after that, you will do like your revenue raising. You will like have the total amount of income generated by the sale of good or services, like related to like your certain resources. And then you will have the pooling aspect. Uh, and pooling is the process of grouping your resources for like two purposes in general, like to maximize the advantage or minimize the risk related to financial aspect. And last but not least, the purchasing step. And here, like you can like use the goods or services to accomplish your certain goal. So the goals are determined by the government and the leadership of that health systems. And at the end, you will have your service delivery. Then the government and the leadership will define the policies how they can like benefit from that uh, health system or health financing scheme, and to design their way in order to like invest their income and revenues in order to like have a rational use uh, for these services. So after that, the like the health system will be efficient. Will you will have an equity in resources distribution or order, and also you will have like an accountability, and these three pillars will contribute in order to achieve the UHC objectives. And at the end, like the final coverage goals will be a good utilization relative to need. Like the utilization of the health services in your health system should be according to the need and not randomly, because this is one of the most like one of the famous problem in each health systems. Even if that health system has like a good financial plan or uh, a good resources allocation, but the utilization should be relative to the need. And um, we can have a good example for that, which is the health system of the USA. They spend a lot of money on their health systems, but they do not have utilization relative to the need. Uh, so you will have a lot of out-of-pocket expenditure, uh, and uh, and that will lead people to have financial hardship. Um, and also you will have the quality and the financial protection, of course, at the end of the day. Next slide. Uh, so if we have an efficient health financing, which is one of the aspects of the health system building blocks, you will ensure financial protection for your community members and equity in finances, and also utilization relative to the need, as we said before. And but you should keep in your mind that health financing is not the most important aspect in the health system framework, because they are working together and each one like complete the other. So health financing is important, but it should work with the other health system building blocks. So this is what I have regarding the health financing and UHC. And if you have question or something, you can ask me.
Thank you so much, Bashir, for giving us your input regarding the different models of global health finances and different aspects of that. And now I actually have a question for you because you have to leave early. So I would like to ask a question from you. We received one in our pre-evaluation form. The question says, as we know, there are talks of introduction of vaccine of COVID-19 around the end of this year or the start of next year. What equitable financial strategies you suggest should low middle income countries should adapt so that it should be equitably distributed throughout their population?
Okay. Well, this is actually a good question. So,
Thank you.
as I told you before, in order to achieve something in a certain health system, for example, now you are asking about the distribution of the vaccines. So, as I told you, countries or health systems should work in the same quality for the all health systems building blocks. Because, for example, in the case of distribution, you will need, for example, the information parts and the data. So you need to know for example, number of your population in your certain countries, the vulnerable groups, for example, the number of patients who have COVID-19. So, for example, the data is one of the most important thing. Then you will need a well-trained or a good health worker or health workforce in order to ease the mission of, for example, using these vaccines or dealing with the vaccines, because of course they have certain measures, for example, in order to use the vaccines or in order to keep it, for example, in a certain temperature or something like that. They should, for example, check the expiry in order to have the proper efficiency of that vaccine. And on the other hand, they should focus on the health financing, because you have to build a good and strong plan in order to cover all the countries, all the areas, especially the rural and the suburban areas and the remote areas, because it's easy to do that in the urban and the urban areas, but regarding the remote and the and the rural cities or villages, it's somewhat hard, because it depends on the country itself, and it depends on the infrastructure of these areas. So in general, countries should work properly on the all building blocks of the health systems, using the data, using the work health force, using the good leadership and policies, and to allocate a good health financial plan. So if they work on all these aspects in good quality, of course, they will ensure a good distribution in higher quality and in the best coverage that they can. I hope that answers your question well.
Yeah, thank you so much, Bashir, for giving us insight towards the chain of supplying the vaccine in the rural areas and remote healthcare. And that brings me towards our next panelist. And the panelist is joining from IFMSA Sweden. She will be presenting live from Sweden, and she will be talking about the global surgery. Lotta, there is yours. Please introduce yourself and present your topic. Thank you so much.
Hi, everyone. Can you hear me well? Can you hear me?
Yes, we can hear you.
Great.
Yes, sure.
So, Adi, will you start my presentation, or should I share it myself?
I think you should start your presentation, because I have to manage the screen. Oh, wait, Usman just started presenting.
Let's see.
Mohammed, are you presenting or should I go for that? Okay, Mohammed just started presenting. Lotta, you can go for that.
Okay, perfect. So 1 second. Right, thank you so much. Hi everyone, my name is Lotta, and like Adi mentioned, I'm from IFMSA Sweden. I was an NPO previously, but I am not super active in IFMSA anymore. And I'm here today to talk about two topics that I'm very passionate about. So climate change and global surgery. And I think these are two topics that you probably both have heard a lot about, but they may not be often talked about together. But I want to talk about the intersection of these two topics. So next slide, please. Right, and you can keep on clicking. So I'm a final year medical student in Sweden. And as you can see here in the first picture, I have previously been very active in climate change and in activism. So this is a picture from the climate change negotiations in Poland 2 years ago, where I was Sweden's UN Youth Delegate. And then here's a picture from my university. And then this past year, I've been a research associate in Boston in the US in the program in global surgery and social change. And if you click one more time, please. And most of this past year, I spent in Rwanda in East Africa, which is a tiny, beautiful country, as you can see in this picture. But it's also a country that's really plagued by climate change. So when I was there, I spent most of my time in a very rural area doing surgery research. But I noticed that climate change is already having its effect in Rwanda, and I will talk more about that later. So next slide, please. Right, and I'm sure some of you have heard about global surgery before, and if you have, you probably know the number 5 billion. So 5 billion people in the world lack access to safe, timely, and affordable surgical care when needed. And just to give some examples of what this means, because I feel like this number is just too big to really get a grasp on. 10 to 15% of all women worldwide need a C-section to deliver their babies safely. And road traffic accidents, which often need to be treated surgically, is the major cause of death of young people around the world. Next slide, please. And another point that I think is really important to talk about, and especially within the context of what we're speaking about today, which is also health system strengthening, is that global surgery can be an opportunity to really strengthen the system from the ground up. So within global health, we often speak in silos. We have people that are very passionate about non-communicable diseases, that are very passionate about infectious diseases like HIV/AIDS, or people that are passionate about maternal health. But these are all separate diseases, and we rarely have a chance to actually talk about the system that they all rely on. And so what's interesting about surgery is that this is not one disease category. You need surgery for non-communicable diseases like cancer, but you also need it for maternal mortality or child health. And so surgery is a part of all these silos, and that means that we have a chance to kind of glue them together and look at the system in a more holistic way. Next slide, please. And so just before we move on to the component of climate change, I think this is, of course, especially important now. I mean, the concept of health system strengthening when we are in the middle of a pandemic. So COVID-19 has really put our health system to a test and tested whether it was resilient enough to really survive a crisis. And clearly, many health systems have failed. And I think this is an opportunity to think about the future for our health systems, because we all know that climate change is already happening and that climate change is likely to just continue and is going to keep putting these tests of resilience on our health systems. And so our health systems are currently not up to the standard they need to be, and there is definitely a need to scale up our work. And so when we think about how climate change is connected to global surgery, we can look at it in two different ways. Next slide, please. We have climate change, and climate change is happening and is going to only increase the need for global surgery. So, for example, through increased prevalence and intensity of natural disasters and so on. But at the same time, surgical care and healthcare in general is actually also contributing to climate change. Next slide, please. So let's start with how climate change leads to the need of scaling up global surgery. First of all, I think this is one of the things that I'm really passionate about, and what I was also witnessing firsthand in Rwanda, is that natural disasters are increasing in intensity and frequency due to climate change. And this puts a strain on health systems. That means we're going to need better disaster preparedness, we're going to need more resilient health systems, and we're also going to need, for example, access to trauma surgery or intensive care. And within this concept of global surgery, we normally also include anesthesia and intensive care. And just to kind of give an example, you might have heard of the Hurricane Maria that struck in Puerto Rico a few years ago. And Puerto Rico, which is like a territory that partly belongs to the US, it's actually a high-income country, but even there, for a whole year after this hurricane, they still had a lack and shortage of medical supplies. So even high-income countries are not prepared to deal with these types of disasters that are, of course, likely to hit low and middle-income countries even harder. Another consequence of climate change is the increase of migration, which is also likely to put a strain on health systems. And then I think another really interesting effect is effects on maternal health and perinatal outcomes. So just to give some examples, rising temperatures, which of course is associated with climate change, are changing the types of infectious diseases seen in maternal health and also in child health. So for example, vector ecology is impacted, meaning that we have increased spread of vectors like Zika virus, which can give congenital anomalies for babies. Similarly, heat waves and forest fires have been shown in studies to lead to increased risk of adverse neonatal and maternal outcomes due to increased particulate matter in the atmosphere. Finally, we know that climate change is leading to health impacts like increased respiratory illness and also potentially increased malnutrition due to food scarcity and things like that. And of course, all of those factors, like an increased health burden, is going to have impact on the perioperative process. So if we have a sicker population, that's going to make all perioperative care more challenging. And so if we now look at the other direction, how is global surgery actually also contributing to climate change? One of the most important factors is infrastructure. Healthcare in general is very resource intensive, and actually all OECD countries, so many of these large economies in the world, plus China and India, altogether, their health systems contribute to 4% of the world's emissions. That's huge. And in global surgery, we talk about that we want to scale up surgical care, and that means we want to expand, and that's going to continue to contribute to climate change. Another important mechanism in which global surgery contributes to climate change is, of course, waste, which we all know is abundant in health systems. We produce a lot of medical waste. And finally, which is actually the biggest point, is anesthetic gases. So in a study in 2010, they calculated the emissions of anesthetic gases within a few hospitals and extrapolated this to a world scale. And they found that the use of volatile anesthetic gases, they were equivalent to the carbon dioxide emissions of 1 million cars. So that's a really big number, and I think something we might not always think about. But what's really interesting about this is that this is not a hopeless scenario, because not all anesthetic gases have the same, they're not the same level of potency in greenhouse gas effect. So for example, desflurane is very, very different in its potency than sevoflurane. And so there's a lot of interesting work that can be done in this regard. Next slide, please. To close off, I just want to show this map, which you might have seen if you have looked at the Lancet Commission on Global Surgery. As you can see, these parts in dark red are the areas where most people lack access to surgical care when needed. And if you look at this other map, you can see the areas in red are the areas that are most vulnerable to climate change. And so you can see there's really an overlap in these two regions. And I think that's something we can realize, that the populations that are already really vulnerable in terms of not having access to surgical care when needed, they are the ones that are going to probably need surgical care even more in the coming decades because of climate change. And so now is really a time to think about scaling up surgical care. Global surgery is now more important than ever, and we have seen that our health systems are currently not up to the standard they need to be. So, next slide, please. As we accelerate our fight towards climate change, we must make sure that building resilient health systems is a part of this, and global surgery is a key point in that. And I think at the same time, we can just be conscious of that as we are scaling up surgical care, we are contributing to climate change. But this is not the way it has to be. If we start talking between the climate change movement and the global surgery movement, there is a lot of potential to actually scale up surgical care in much more sustainable ways. These are just two topics that need to be brought together and not seen as totally separate issues. So with that, I want to say thank you so much, and I look forward to the questions.
Thank you so much, Lotta, for your amazing presentation and how you highlighted the greenhouse emissions from and the different anesthetic gas emissions from the hospital is alarming, and we didn't know about that, and we need to care more about that. Sorry, we have to just take a 1 minute from you and just ask Catalina's question because she has to leave and go somewhere else. So I will shoot the question in the comment chat box. So if people wanna read that, and the question for Catalina is, Catalina, the question for you we have received is, how can we better approach a population regarding pragmatic health measures, especially when some might be misinformed into believing that certain health measures are politically incentivized? Thank you so much. Catalina,
Okay.
floor is yours.
Well, first of all, congratulations on the presentation from Lota. I think it was really amazing. And I'm sorry, I'm like interrupting this, but I need to leave in a couple of minutes. Answering to the question I just received, I think that it's really important for us like to analyze each country's particular situation, since each health system influences the way the population sees how they have to take care of their health. There are many like good examples in my region. What happens in my country, for example, that there is no good primary healthcare system. So some people don't see prevention, so they don't prevent at all. So they feel free to just not take care of their health because the system and the government constantly gives them that message through the policies and the decisions they make, you know. And kind of the same thing happens with the USA. That was something that was also mentioned to me. The USA is one of the examples we analyze the most because we are almost all the time compared to them, all of our countries. They have all of this conception, and they are told of this conception that they have to look up for themselves. Their health system, as my public health teacher at the university said, is not actually a health system. They pretty much have to look up for themselves in their health, financially, and in all of the aspects of their life. So that influences a lot their way of living, bringing us to images that shocks many of us. For example, people not using masks or people saying that they are free to do whatever they want, so they just go out despite COVID. They don't have this conception of health as a whole, as something that affects all of us, and that we have to look up for the other, because the system told them to not think about that, you know. So we have to see the behaviors of people as a reflection of what their health system is telling them to do, and therefore as a reflection of what their governments are doing. So yeah, what can we do? We can always fight this through education, and I think we should always do that. Despite what is happening right now, more than ever, we have information available for everyone, and we have evidence available for everyone. And I know it's frustrating to see all of these images and to see all of these people doing all this maybe incoherent things, but we need to fight against that, and the best thing to do is to be patient and to educate. So I think that's my answer. I don't know if that answers the question. Hello?
Yeah, thank you so much, Catalina, for answering the question. And now brings us to our fifth panelist, Bia Berman. And I can proudly say that she is my inspiration for working for the global health. And she was actually a person when she was in Rwanda, and she motivated me to join the Digital Fridays for Future campaign. And your work is so moving. And I will leave the floor to Bea. Thank you so much for having for believing in our initiative, and now floor is yours. Thank you.
Hello, everyone. Can you hear me?
Yes, we can hear you.
Okay. So, it's an honor to be here. My name is Bea. I'm a fifth-year medical student from Switzerland. I'm the current Swiss youth delegate to the WHO and the former president of the Swiss Medical Students Association and part of the Swiss SDG network Collaboratio Helvetica. And today you've already heard a lot of inputs on resilient health systems and climate change. And it's an honor to speak after those super competent speakers, and especially after so many important facts on global surgery from Lotta. And I'll today bring some insights in how we can use all that knowledge to drive forward a systemic approach towards a healthier future. But since we've been talking about health now for an hour, I think first let's be healthy together, and let's just all move on our chairs, because we're all sitting in front of our computers, and just stretch and maybe try to find a comfortable position and to breathe, and just be also aware of your posture, because it's really important to be healthy yourself when you're sitting the whole day in front of a computer. Yes. So I hope that we're all set now, and I will start off with a quote. And I've moved to the old-fashioned way. I haven't brought slides with me, but I've brought a quote. And the quote is from Einstein. He went to the same city to university as I'm from in Zurich. And he says, "We cannot solve our problems with the same thinking we used when we created them." And since today's panel is about health system, and we all know COVID-19 highlighted the deep flaws in our health systems worldwide, if we follow Einstein, this would mean we need a new way of thinking in order to solve our problems. And this sounds pretty smart. And when I started becoming an activist, I was totally yeah, I want to solve problems. I want to contribute towards health. I want to become active. But I felt quite unsure when it came to this new way of thinking. What does that even mean? So today I brought for you an example. And I guess most of us in this call here, in this webinar, we're students in the healthcare sector. So we're medical students or nursing students, and we know when we're in the emergency department and there's a sick patient, it's not just sufficient to stick a plaster on the wound, right? We take the time to do an anamnesis, further clinical examination, maybe an x-ray, we run a blood screen, because we want to find the source of the problem and then treat the source. And for us, it's clear only fighting the symptoms will help only in short term. And we really need to find the source in order to treat the patient in long term. And this image of symptoms fighting is similar to the way we try to do health politics and activism today. In Switzerland, we actually call this Pflasterli-Politik, so this is Swiss German, my language, which means in English, plaster politics. So we see a problem, we put a plaster on it, we don't take the time to go deep. Okay, so this is like this whole concept. So what does that mean in practical? So, for example, in Switzerland, over the last decade, we could observe the following situation. With the framework of the sustainability goals, the Sustainable Development Goals, the SDGs, which the UN has set itself for 2030. There are a lot of initiatives and organizations going on where there are a lot of projects, and just on the whole world, there are so many things towards the SDGs, but we still cannot see this big transformation we would like to see in order to really, truly achieve the SDGs. So what can we do to do this kind of big transformation? Well, we need to go away from just plaster politics, but really go deep. And I just give some examples what that would mean in practical. For example, we observe a lot of plastics in water, right? And there's quite a lot of research and projects going on to take the plastic out of the water, but there's not as much research going on to find out how we can avoid plastic getting into the water. So this is a very obvious example. If we take this to the health system, we know that almost half of the doctors and nurses worldwide will suffer from burnout once in a career. And in order to change this mental health of healthcare professionals, we could, for example, go and say, okay, let's offer free mental health care for all health professionals. But what would that be? Plaster politics, right? It's just, we stick on the plaster and it's not a long-term sustainable solution. It's only symptoms fighting. In order to change mental health of health professionals, we would have to start to sense deep into the existing system. For example, we look at working hours, at hierarchies in the healthcare systems, and how we communicate with each other. Also, the image of health professionals, that we are like altruistic, we always want to help, we just always work. And this is not the reality. We are also human beings. We also need a work-life balance. So in order to change, for example, mental health, we need a holistic approach, and we need a paradigm shift to address these sources and causes of the current system. So in order to influence those symptoms we see in the long run. So maybe it's a little bit more cleaner what I mean with these new ways of thinking. So what does going to the source mean now for the current situation of a global pandemic? Well, so COVID-19 as a zoonotic disease, it has delivered quite a stark lesson about the global interconnectedness of human, animal, and planetary health. This is also known as the One Health concept, or also as the planetary health concept. So the decisions we are taking during the 18 next months, they will fundamentally define the health of all future living beings. What we see now is that all governments and politicians around the world have mobilized huge amount of money to save economies during the COVID lockdown. And we need to face the fact that aiming to recover an economic system that inherently fuels the climate crisis is just as absurd as it sounds, right? It's just putting a plaster on the problem. And our current system is not broken. The system is doing exactly what it's supposed and designed to be doing. And it cannot longer just be fixed with a plaster. We need like systemic change, and we need a new system. And actually in the international health movement, there have been quite many people calling for a healthy and green recovery. There has been a WHO manifesto and over 40 million people, an open letter to the G20 leaders in the name of over 40 million health professionals, calling for concrete actions towards this recovery in the post-COVID times. And if you now feel like doing something, okay, I want to do something, you can, for example, after this webinar, take the time to sign this open letter from climate activists all around the world. I will just post the link in the chat. Wait a second. Et voilà. And you can sign this one. And they ask global leaders that we start facing the climate emergency. And for me, every time I saw like global initiatives on this, I was super motivated. And I was like, yeah, I want to become active for a healthier future. I want to join the fight against climate change. I want to do this in a sustainable way. And just one last thought. Sometimes I got really overwhelmed because if you look at the climate crisis, if you look at our health systems, it's so complex. And a lot of people overwork themselves because health depends on so many things. And if you really want to do it sustainable, wow, it can just be so overwhelming. And activism burnout is a thing. So in order to create systemic change, we also need to start with ourselves. We cannot leave out ourselves and the health of ourselves. We also need to question the system in ourselves. We need to question the paradigms and mindsets in ourselves. This takes time and also courage and also a bit of vulnerability, because you need to take the time and pause once in a while and question the ways of thinking in yourself. From which mindset do I act? And what are my values? And maybe I discovered that I act totally out of guilt, or like I'm always super stressed because I feel the apocalypse is coming. And this is a negative way of working out from. And if I transform my own paradigms and I can act from a healthy point of view, then this can give a totally new and healthy quality to my work. And I know this is very abstract and different to the other talks, which are based on really facts. But this is needed, right? We need the time and space for also our inner transformation for us and as a group. And if we work this way together, also in a healthy and respectful way, we will also find more sustainable solutions with this new way of thinking. Instead of just thinking, oh my God, climate crisis, global health crisis, let's stick a plaster on it. And I'm not saying there is one perfect solution for you to work towards a healthy future. It's a joint trying, feeling, navigating, and discovering, and having the courage to go deep and discover new ways of thinking. And this journey is totally worth it. And I will finish off with another quote I brought from Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And I hope that gave you the spark to also become active and do something yourself. And I'm looking forward to any questions later on. Thank you very much.
Thank you so much, Bia, for your insight into the planetary health and One Health approach. These might be the hypotheses of theory according to you, but they are such motivated words, and I hope they would be moving enough to move at least one member of this webinar or panel discussion so they can make a change in the society. And that make us to move towards our last panelist. She will be joining us from Egypt. She is IFMSA's liaison officer for public health issues. Her name is Amina Al-Amrani. Amina, the stage is yours. Thank you so much.
Yeah, thank you so much. I feel like there has been so many amazing presentations. So I'm really happy to be part of this initiative. And yeah, so Mohammed, can you please share the presentation? Mohammed, are you here? Oh, okay, perfect. So yeah, and as you all know, I'm Omnaya Al-Omrani. I'm a final year medical student from Egypt, and I'm also the liaison officer for public health issues. So mainly the external focal point for what IFMSA does, especially on climate change and NCDs and mental health. I don't know whether the presentation disappeared. Oh, okay. It appeared.
It just.
Yeah. Okay. Perfect. Yeah. So I'm here to talk to you about also what already Lota mentioned and Bia mentioned. It's such a motivational way that I'm really motivated now about, what it means to have a resilient health systems, but also from a planetary health, from a climate perspective. So next slide. I'm just going to share with you two of my very favorite diagrams that really explain the link between climate change and health, and then the link between climate change and health systems. So as you can see, this is a very comprehensive way of explaining how climate change impacts our health through a diversity of ways. When we talk about air pollution, we automatically think about the respiratory diseases, lung cancer, cardiovascular diseases, asthma, and so on. And then when we think about the natural disasters, how they lead directly to physical injuries, and then at the same time they lead to damages to our healthcare system, as well as mental health diseases because of the trauma. We can see post-traumatic stress disorder, or if we lose one of our loved ones. So this leads to depression and also anxiety and so many more mental health conditions, one of which is very famous now and a terminology that is commonly used, which is the eco-anxiety, because of the feeling of distress of not being able to do enough to drive countries to take action for climate change. And then on the other hand, there's also the infectious diseases like malaria and other vectors. But now we're living one, which is the pandemic that we're seeing, COVID-19. And there are many links to human activities that led to the degradation of ecosystem, and how this have led to a pandemic like COVID, and to also many more in the future. And then there are also other impacts related to our food system. So we're talking about malnutrition, as well as water pollution, which leads to water-borne illnesses like cholera, and so much more. But what I really want to focus on is another aspect, next slide, which is the social dynamics that are related to climate change and health. Because you know how there are social determinants in health, but there are also environment determinants of health. And this really impacts our vulnerability to the climate change effects that we're seeing. So we need to think about the age and the gender, because, for example, elderly and children are more vulnerable to the direct health impacts of natural disaster and extreme weather events. For example, those who are living in much more like in low socioeconomic statuses and vulnerable populations, they are really impacted when it comes to extreme weather events and natural disasters. Those who are living with chronic conditions, for example, if someone has a chronic asthma and he's living in a city that has high levels of air pollution, then they are more likely to be, suffering with the respiratory disease, as well as this would lead up to lung cancer. So these are different social and economic dynamics that make us more vulnerable, more weak to the climate change impacts. And that is why, next slide, we need climate resilient health systems. And this is a quote that I really like, which shows that, what is the definition of a resilient health systems? It really means that our health systems are able to give us a good health outcome, to accommodate our needs, both during a crisis and during its aftermath, which is really what we're seeing now. It's not just climate change, it's also, as Lota mentioned, COVID, which is a wake-up call to how our health system is weak. It's not able to accommodate the huge number of cases that were coming from a simple global health threat like the like the coronavirus. So it's also the same with the climate crisis. So that is why we need to think about the future of our health system. We need to think about the resilience of our health system. Next slide. So how can we build health systems that are resilient to a pandemic that we are seeing now, but also resilient to climate change? Next slide. So health systems, as you all know, they aim to protect and promote health, as well as facilitate community resilience, because they are responsible for the health outcome of individuals as well as the population as a whole. So we, as being an integral part of the health sector, we need to collaborate with all the different sectors to make sure our health systems are resilient. We do not, as also Lota mentioned, not work in silos, work together, engage in order to advocate for resilient healthcare systems. Next slide. And this is another very favorite diagram of mine, because now we're talking a lot about strengthening healthcare systems. So I'm sure you've heard about the building blocks of a healthcare system and what makes our healthcare system, what is the structure mainly of our healthcare system. So as you all know, we have 6 building blocks. I always start with the service delivery, and then we have the essential technologies and drugs that are, provided in a healthcare system. We have health information system, which is the data available from the patients and from the population. We have the health workforce, which is us. We are the future health workforce. And we also have the leadership and the governance of a healthcare system. And finally, the financing. So each building block has its own way of being climate resilient. So the first one, which is the service delivery, we need to think that the service that the healthcare system is provided, it needs to be adapted to any emergency. It is well prepared for any extreme weather events that are happening. We need to make sure that our our healthcare system receives early warnings in order to be well prepared for any upcoming, let's say, hurricanes or flooding or any extreme weather events. And at the same time, healthcare providers must put both the social determinants of health as well as the environment determinants of health into consideration while treating the patients. So this is the next one, Muhammad, in the diagram. Perfect. And then at the same time, our healthcare system is really based on technologies as well as infrastructures, but we need to make sure that the technologies, the infrastructures, the different, gases that are used, all the different aspects that we are using in order to deliver care, they need to be sustainable and environment friendly with the least carbon footprint. Next. Yes. So we have climate resilient and sustainable technologies as well as infrastructure. And then next, our health information system. So the healthcare system and hospitals and healthcare facilities, they can really give us a lot of information about what are the diseases that are most prevalent in the community. They can really help us tackle the research gaps between the climate and the health impacts of climate change on our own health, so we can use them to gather the necessary information. And for example, IFMSA is working with the World Health Organization on a project that identifies all the different gaps between climate change and health. And we've been screening a lot of researches that identify what are the most, how is climate change impacting infectious disease like malaria? How is climate change impacting respiratory diseases like asthma, especially in polluted cities, and so on. But still, there are many gaps between climate change and its health impacts. And then next. And then finally, we need to think about the health workforce, which is what I'm going to elaborate more about. Next slide. So first of all, when we think about the healthcare service delivery, we need to make sure that the health workforce, and not just us as future healthcare professionals, but also the nurses, all the different actors within a healthcare system, do they learn about climate change in their own medical curriculum? Do they know about it, or just through, for example, working in an NGO or a side activity like with IFMSA? So this is why IFMSA is really advocating for the integration of climate change in the medical curriculum. And it's not just IFMSA who's doing that. The nurses as well have been doing a lot of curriculum integration, especially in the US, where there is a movement called the Nurse Drawdown, and they have created a curriculum that links climate change and health to be directly inserted into the curriculum of the nursing education. And we're also doing the same in our medical education. Next slide. And then when we think about, as I said, the sustainable technologies and the sustainable infrastructure of a healthcare system, we need to think about the carbon footprint of a healthcare system. That is why, next slide, organizations like Healthcare Without Harm and also our own NMO in Australia, they have been doing a project on how to make hospitals greener and more sustainable. And also in IFMSA, in our meetings that we do every year and workshops and so on, we make sure that they are sustainable with the least carbon footprint. We develop recommendations for our members to use to make sure that they themselves are sustainable, but also our meetings and the workshops and the conferences that they are doing, they have the least carbon footprint. In addition to holding organizations like the World Health Organization accountable for the carbon footprint of their own meetings. Next slide. Also, as the future health workforce, we are not just responsible for our own education, we are responsible for the advocacy within our own community. That is why, next slide, we have a role in advocating for climate change and health and the interlinkages, and also a role in building climate resilient health systems. That is why we do a lot of workshops in IFMSA, and also our medical students are doing a lot of capacity building for their own members to learn and to link between climate change and health. Next slide. And at the same time, we do not do this on our own. We collaborate globally with the World Health Organization, with the Global Climate and Health Alliance, next slide, in their own advocacy to really push for climate change and health to be interlinked. And this really will pave the way for us to advocate both within our community and within our healthcare sector. Next slide. And that is why, as Bia mentioned, I'm really happy she talked about the healthy recovery, because now also COVID-19 presents an opportunity to, as everyone hears a lot, build back a new normal. And this means that we have an opportunity to build a sustainable world, because we have already seen it. We have seen how the lockdown already made that breathe in cleaner air. We are seeing water pollution way less. For example, in Egypt, the river now is clear. The river Nile is clearer than ever. And I have never seen such a beautiful water quality in our own river. And that is because of the lockdown. That is because of the urgent measures that our leaders took because of a global health threat. And this means that we have it in ourselves as countries, as communities, to work together to build a sustainable and a strong and a resilient healthcare system. And that is why we as IFMSA, we joined more than 350 organizations worldwide calling on G20 head of states to finally put our public health and the health of our environment first, and to invest rather than just investing in the economic projects and the fossil fuels and all the projects that really do not put our public health and our environment health first. We're asking them to invest in them, to put them at the heart of their recovery plans. And this is why it's really important for you to know that you are also able to call on your governments, to call on your ministries to really build back better with your help, to work with you collaboratively and build a healthy recovery. Next slide. As you can see, this is really one of the most, diagrams that I love that link how, this is the time to live in sustainable cities, to link all the SDGs, the SDG 3, to put good health and well-being at the center of the cities as we try to build them back. Next slide. And finally, when we put, when we put the capacity of our earth, when we put sustainability first, we can flatten the curve and we can make sure that, we're not just doing the business as usual, just thinking about the economic gain. We're thinking about our own health first. So now it's the time to flatten our own curve and build a climate resilient health system. So finally, I'm really open to any questions that you have in mind. And thank you so much for having me part of your amazing session.
Thank you so much, Amia, for being part of our initiative. It was really a great insight into climate resilient health systems and eco-depression was a new concept for me too. So thank you so much for always bringing, every time you bring new things to the plate. That brings towards the question of the participant, what we received in re-evaluation form. The participant asked is, which tier of health hierarchy, in your opinion, is the most important for achieving universal health coverage in the post-pandemic world? The primary healthcare, or the secondary, or the tertiary? Yeah, floor is yours. We are not able to hear you. You are.
Yeah. Can you hear me now? Yeah, perfect. I was saying that this is a very interesting question when you're trying to think about, okay, we need to advocate for universal health coverage, we need to see it happening. And personally in Egypt, we have approved the law of universal health coverage in 2018, so 2 years ago. And in Egypt, we really don't have that much strengthening of primary healthcare. So in my opinion, I feel like each and every aspect, it is important and it is integral to invest in, because now is the time to invest in the health sector. Now is the time, because nothing can happen without the proper investment in the healthcare sector, as we have seen now with COVID, because it is a health threat. And now we decided to invest in, we acknowledge the importance of investing in a healthcare system and providing quality healthcare services for everyone. I think that, coming from a country that does not really address primary healthcare, we do not have general practitioners. This is not something that we, invest in. I believe that it is really important, because you start from addressing the social determinants and the environment determinants of health of an individual, which really makes them able to either, whenever a pandemic comes or a natural disaster comes or anything, we need to think about the baseline health status of the person. And this is really targeted comprehensively with primary health care. So this is why I think in many countries it is really forgotten, and we need to really highlight it. And in my experience working as a liaison officer in IFMSA and representing the stances of medical students, I had the exceptional opportunity with working with many general practitioners who are also advocates, and they are very involved in policy making. And policy making is really important because it shapes the overall health of the population. So this does not in any way mean that the secondary and the tertiary care is not important. However, there has been a huge direction in that aspect more than the primary healthcare, and it is often forgotten. So this is why I really want to bring in the importance of primary healthcare. And also there are many of us as medical students, we don't think about it as a specialty because it's not as satisfying as working in surgery or working in many other specialties. But this is very, very important for you to bring in. And I personally would love to bring in these kind of specialties in my own country and highlight the importance of primary health care as a baseline assessment, as strengthening the health of the individuals, as also working on the health inequalities that is now multiplied by COVID and will be multiplied by further crisis if we don't really act on them. So I hope this answers your question. Yes, there has been a noise. Hello? I can't hear anyone.
I'm not sure because Muhammad is not speaking, so I am not able to answer them. Or maybe Muhammad is here, but we can move on towards B. B, are you with us?
Yes, I'm here.
Okay, thank God. Okay, the question for you is, what is the role, would you kindly speak more about the recent World Health Organization manifesto for a healthy recovery for COVID-19, especially for COVID economic recovery? What does it mean?
Okay, so building up on this open letter on a healthy recovery that Omnia has mentioned and explained everything about. The WHO has also done this manifesto where they openly address as well this issue, and they pick up 6 points actually. Now we'll just quickly mention those 6 points. So the first one is protect and preserve the source of human health, nature. So this is just the first thing. Instead of trying to plant new trees, we just need to try to preserve the nature that is there, and so not take away those trees and stop deforestation, right? Second point, We need to invest in essential services, from water and sanitation to clean energy in healthcare facilities. So this, like the basics also of UHC. Third one is ensure a quick and healthy energy transition, so from fossil fuels to renewables. Fourth one is promote healthy and sustainable food systems, because the food sector is actually the biggest contributor to global greenhouse gas emissions. So we can change a lot just from the way we eat. And there's this concept, probably a lot of you know about it, it's called planetary health diet. If you don't know about it, I highly recommend to check it out. It's from the newest Lancet Eat report, and it promotes a healthy and sustainable diet. And this is something we as future doctors or healthcare professionals really should know about, what we recommend and to eat for our patients. Fifth point is build healthy and livable cities. We have had quite some amazing initiatives from some cities to transform their transportation. For example, London has increased their cycling lanes, Milan as well, and quite a lot of cities have said we want to transform from, like, reduce the load on the public transport to just bicycling, because there you can keep the social distance. So this is amazing, and I hope to see more, that it lasts also post-COVID. And the sixth and most important one is stop using taxpayers' money to fund pollution. At the moment, we cannot use money anymore and not use those stimulus packages for the economy to fund pollution, because this means harming our health. Every money which is moved around now in order to save the economy should be used for our health and not to harm our health. And as soon as we take these economic stimulus packages to fund pollution and to invest in fossil fuels and to support the old system, we harm our health. So now we are really in this crucial moment, and this is the essential of this WHO manifesto, that we can change the future health. That's it in the 6 points. Did that answer to your question?
Yeah, thank you so much for giving us insight into healthy recovery, and especially mentioning the city of Milan. And recently the city of Bogota from Colombia also implemented this thing, and Paris has also joined this green movement. Now that brings towards my question to Lotta. Lotta, are you with us?
Yes, I am.
Yeah. Okay, Lotta, the question is, in recent World Health Assembly, the 73rd World Health Assembly, they presented a robust COVID-19 response strategy, but missed out on addressing global surgical hair strategy in that resolution. As you mentioned in your presentation, how much we need surgical care, and we are lacking that, and World Health Organization, being the leading organization, has missed this strategy in this COVID-19 robust response from that. What are your responses? How you're feeling?
Thank you so much. I think that's a really great question. And I think this is it's probably not very surprising. I think, as you may know, global surgery has long been called the neglected stepchild of global health, something that many people have thought, that's not an urgent concern. Let's first focus on things like infectious diseases, and then surgical care is somewhat a luxury. Let's handle that later. And we all know that's actually not true. Like C-sections is not a luxury, it's something we need. And so I think within this plan, it has not been seen as a vital part of the response, because COVID is an infectious pandemic. And so what does surgery have to do with that? But I think what I hope has become somewhat clear in the presentation today is that investing in surgery means not just in operating theaters or so. It means investing in this whole system and building a strong system. And we need a strong system for future pandemics, but we also need it for climate change and for other disasters that may not be infectious, but maybe rather an increased trauma burden, which we may see, due to climate change. So I think this is really a missed opportunity, because this response strategy should have been The goal must be to build stronger health systems for pandemics, but also for other crisis situations. And without investing in surgical care and operative care, we won't reach that goal.
Yeah, thank you so much for your response. I would like to just add one quick point into that. Recently, according to United Nations Development Program, Pakistan has already achieved Sustainable Developmental Goal number 13, that is climate change. Pakistan has planted 1 billion plus trees in country, and we are moving our economy towards more greener. As our Prime Minister spoke last week on the World Economic Forum, and the city of Hamza in northern areas of Pakistan went plastic free. So we are like 10 years away from Agenda 2030, but Pakistan has already achieved the Sustainable Developmental Goal number 13. So I am feeling proud as a Pakistani right now. So that would brings me to my question towards last question towards Muhammad. Muhammad, are you with us?
Yes, I'm here.
Yeah, okay. Mohammed, the question for you is, what is the role of private healthcare sector in achieving universal health coverage? Can they be considered as a potential asset for achieving health equity when it comes to service delivery and health finances? Thank you.
Okay. Thank you very much for the question. I guess it's a great question. So basically, most of the health systems worldwide are a mix between the private sector and the public sector facilities. So they are already a great part or a major part of many health systems, and they need to be considered. Generally, when we speak about universal health coverage, we encourage the collaborative approaches and we encourage the collaborative work. So it's really important to consider them, and it's really important to include them. The way we can include them or the way we can make use of them is not very clear because it's context based, and usually the WHO and the USC 2030 encourage state actors to foster dialogue between the private sectors and the public sectors in regards to universal health coverage and what each sector can offer, because it really depends on the context and it really depends on what the private sector is looking for and what the government can offer. So yeah, I hope that I answered the question.
Yeah, thank you so much, Muhammad, for your question. That brings towards conclusion of our day one. And we had an amazing discussion about building the climate resilient health systems and why they are needed more than ever. And I just want to thank each of our panelists for joining us and taking our time for busy schedule and believing in IFMSA-Pakistan. And I want to thank participants for taking out their time in this pandemic as their online classes are going and they have took their times out for this meeting. Thank you so much everyone for joining us, and now we will conclude this meeting. I think if I will disconnect the meeting in 10 seconds. If you wanna leave, you can leave, and I will disconnect in 10 seconds. Good night, everyone.